Tánaiste, I want to ask, could we have an immediate review of the HSE priority list for vaccination programme? Because there are a number of inconsistencies with the HSE's own guide of vulnerable people, and very seriously vulnerable people, cystic fibrosis, family carers, and indeed home helps. But I have a situation temporarily also of Valerie, a wonderful young woman who had a terrible accident some years ago, and has 24/7 care, which she organises herself, for her parents do for her, in a private capacity, out of an award she got from the HSE after a devastating accident. She has 5 carers full-time and 2 part-time. I've been there a few times to see her, and they're very worried in case, they can't, anything happens to any of the carers go down, because there's nobody to care for her. There's a private person employing these people, paying PRSI and everything else. And also the the CS patients are hugely concerned, because we know how vulnerable they are. And they're regarded as being very vulnerable by the HSE in one list, and in the vaccination list they're not. So there's huge inconsistencies there. Could you please have it reviewed immediately?
Thanks very much, Deputy. The prioritisation is done by the National Immunisation Advisory Council and also signed off by NEFID. It is based on medical need and medical risk, with those most at risk of getting sick and dying being vaccinated first. That's residents in nursing homes, and those most at risk of contracting it, getting it second, and that's, of course, healthcare workers. We will then move on to the over 70s. We hope to start vaccinating them next month. And by the end of March to have about 1 million people having had their vaccine, both doses, and about 400,000 or so at least having had their first dose, and that would be the healthcare workers, nursing home residents and staff, and the over 70s. I think perhaps at that point, when we have those 3 groups done, then that might be the time for NIAC to review and look at the prioritisation order again, but I don't think anyone can doubt that those 3 groups are the ones that need to get it first.
So moving